Well, hello, everyone. Thank you so much for joining us. My name is Aubrey Rhodes, and I have the privilege of serving as LCRF's Executive Director. Our mission here at LCRF is pretty simple. It's our middle name, research. We work to fund research to improve outcomes for patients. And, one of our big priorities here is really ensuring that the patient has all the information, the latest and greatest in research, so they can make the most informed decisions. So that's why we have these sorts of calls. We've actually got a really great call today for you. We're going to be talking about some alternative therapies for lung cancer. But before we get started, I just want to remind everyone, while you're on the call today, please remain on mute. We will have the chat open. So if you have any questions, feel free to chat those in, and we will try and get to all of the questions that you have. If we don't get to them here, we will follow up in an email following the call. So I also wanted to let you all know that we are firming up our event schedule for 2024. So we've got all of these together separately that we'll be hosting next year already on the calendar, and you can go ahead and get registered for those. Some of the speakers we're still solidifying, but the dates are firm. So we hope you will join us for those. And without further ado, I would like to introduce to you our moderator for today's call. She is the chair of our Education and Engagement Committee, Dr. Isabel Preeshagul from Memorial Sloan Kettering.
Thank you so much, Aubrey, for that lovely introduction. And it is so great to see all of you here joining us today. We have so much to talk about, and I really want to dive into the data, but I would love to introduce our guest today, who needs no introduction, but I feel very honored to be able to brag about how wonderful she is. So as you can see, we are joined by Dr. Narjust Florez. Dr. Narjust Florez is the Associate Director of the Cancer Care Equity Program and a thoracic medical oncologist at the Dana-Farber Brigham Cancer Center and a member of the faculty at Harvard Medical School. Dating back to 2022, Dr. Florez also became the first Latina to hold an associate editor position in oncology as the new associate editor for diversity, equity, and inclusion for JAMA Oncology. Very, very prestigious. Dr. Florez's clinical interests include targeted therapy for lung cancer and the care for women with lung cancer, including their unique aspects of cancer survivorship. She is the principal investigator of the Sexual Health Assessment in Women with Lung Cancer, or the SHAL study. And this is the largest study to date evaluating sexual dysfunction in women with lung cancer. Dr. Florez also joins me on LCRF's Education and Engagement Committee. Welcome, Dr. Florez.
Thank you. Just as a nice story, when we started together separately during the pandemic, I remember we used to do yoga classes at the beginning. And then I remember that was some of my first yoga I used to do, is started with or together separately. And now I do yoga often. So this has helped not only many patients, these events, but also has helped me to at least be able to touch my toes now, which I wasn't able to do for like 10 years. So I remember those days, Ari, I don't know if you remember in 2020 when we had the yoga classes on Zoom. No, those are some good and bad days.
So speaking about yoga, we are going to be talking about something that I feel really deserves a light to be shined on it. We spend so much time on this platform and other platforms appropriately talking about, pushing the needle forward, research advancements, therapeutics, but we really don't spend a lot of time talking about complementary medicine and alternative medicine that is so essential and really should be just as important as talking about therapeutics when talking about lung cancer. So I really would love to dedicate this hour and maybe, depending on how successful this is, more time to talk about integrative medicine, complementary medicine, alternative modalities in this space. Before we actually talk about what those modalities are, let's just do a little bit of housekeeping. So NJ, can you tell us a little bit about what you mean when you talk to your patients about what complementary or alternative medicine is?
So the first thing is we have to differentiate these terms because they are not the same, and they're unfortunately used interchangeable: alternative, complementary, integrative. So alternative means instead of traditional treatment. So instead of targeted therapy, instead of immunotherapy, instead of chemotherapy, the patients do other types of treatment, alternative treatments. And that's where the word comes from. And that's what we need to be very clear about the term. Alternatives, you don't do, some of my patients, you don't, some of the more FDA approved, kind of toxic, not toxic drugs. Then we have complementary, which is my preferred term. Complementary is all these other things, not only therapies, not things that you take, not only things that you put as a patch, but activities that you do that complement your survivorship with lung cancer and the treatment side effects. So complementing, supplementing, or helping you tolerate therapies or just dealing with the disease. So that's what is complementary. Integrative medicine is a little more similar to complementary. Integrity means it brings you as a whole being. It sees patients as a whole entity. And that's what is the part of integrative, right? Patients are not and should not be defined by their cancer. That's one thing that happens to them, but there are full individuals with full social nucleus and families. So integrative is we're integrating treatment for humans as a whole. So alternative is instead of, complementary is to make things more tolerable. Complementary and integrity can be similar, but integrity has the aspect that sees our patients as a whole, not only as a patient with cancer, but a patient that has neuropathy from the diabetes, a patient that has other issues besides their cancer. And that's how patients should be seen. We should see our patients in a holistic manner because we know that they will do better that way.
Well, thank you for even cleaning that up, because I definitely need to rephrase some of the questions and the way that this interview is even going to be handled today. You have just taught me something. So thank you for explaining that to me. I think in regards to complementary medicine or integrative medicine, can you tell us about some natural products and some practices that you advise your patients or approve of in regards to, your clinic and how you run your clinic?
Well, that's a very long answer. Hope you guys are ready. So let's stretch as I answer this very long question. Okay. So I like the people that follow the book. So the first thing I recommend and to patients, providers, and anybody is to have an open door policy, to talk about this very openly, because there's two things. First, as patients with cancer, it is normal and expected that our patients want to do everything that is possible to help their current situation. Okay, so we all should, providers and doctors, come with an open door, open mind policy, that this is no anybody trying to say that's better than other therapies or another, because they're integrative, complementary. So I tend to be I normalize it very often with my patients. And in my clinic, I actually have ginger snaps and ginger candy for nausea. I have it in a bowl and Ziploc bags from ginger people. I have zero disclosures with ginger people. I just think they're the best for nausea. So that is already an invitation to know that I believe that there's more than just pills. Because this ginger candy, especially the hard candy, tends to be very helpful for nausea. So a lot of my ladies have this is something I started like a year ago because I couldn't keep them away for COVID. I wasn't permitted, so now I'm permitted to do it. So a lot of my ladies have this ginger candy, hard candy in their bags because they get the Ziploc bags from my clinic. So the first thing is to open the door and understand that our patients are doing research outside of traditional FDA approved drugs because they want to do the best they can and open every possibility. So I started with an open question at the beginning when I do the med reg. After we do the med reconciliation of all these medications that patients are taking, I ask, are you taking any supplements? And sometimes supplement, I have seen many concerning alternatives. Thank you, Lara. I know you for quite some time. So, and we're going to talk about vitamin C later. So, I lost track. When I do the med rec, I really ask about, are you taking any supplements? Are you taking any vitamins and the dose of the vitamins? And are you taking any remedies? Because culturally speaking, those three things can be very different, right? So when you do the med rec, you say any supplements, your patient will say no. But then Maria, my Dominican patient, she's making teas with these herbs. So she doesn't call it a supplement. She doesn't call it a vitamin. It's a remedy. So it's very important that we ask about supplements, vitamins, remedies, or any other medication or non-medication that you're taking or doing, so I can help understand to make sure there are no interactions. So I'm very clear. I have lost patients to complementary medicine, and that's why this has become a very important part of my work, because I don't want to lose any other younger women to things that can be harmful. And that's why keeping the door open and talking about this. And I use a lot of grandma remedies. And my patients know that. And that's what we talk a lot about this. And the first time I tell my patients about vinegar soaks, they look at me like, what is she talking about? And I'm like, yeah, let's do vinegar soaks, let's do cryotherapy. All of these complement their journey. So the first thing is to keep it open. Why do I recommend? The number one thing I recommend is to remain physically active, and that's a complementary medicine. Remaining physically active is complementary medicine. It's the number one remedy for cancer-related fatigue. It has been done in randomized trials. It has been in many ways. And how do you remain physically active? It's very patient individual. I know Karen, who's in the call, likes to do yoga, for example, and she likes to go on hikes. So that's what we work for her. But then I have another patient that she doesn't like to go outside. She is from Brazil, and when it gets below 50 degrees, she's not outside. So what she does is she goes up and down the steps of her building. She doesn't want to go to a gym because she's afraid of being exposed to infections, which is very valid. We have a picorhinovirus in Massachusetts right now. So I open the door. I discuss what is there. But my number one recommendation is exercise, and we talk about diet because it's very important. Medicine is food, and what our patients eat is very important. But also, do they have food security? Because medicine is food if you have access to food, right? So I tend to have the cutting board rule. I came out with this many years ago, and it's like, are you using your chopping board when you cook? Let's think about it. Every time you use your chopping board, you're usually chopping vegetables or meats. So that's the rule, that they have to use the chopping board to cut a vegetable. Instead of coming out with these very complicated diets that may not be affordable, it's like, let's make sure that every big meal, like lunch or dinner, you're using your cutting or your chopping board, because it's most likely they're going to be chopping vegetables. So that has been a very quick way to communicate. And the third thing I recommend, there's a lot of things I recommend, is meditation and mindfulness. I do it myself. I don't think with this personality and the job I do and how personally attached I get to my patients, I can do this. So at Dana-Farber, our patients get free access to Headspace, free membership, so without the commercials and stuff. So a lot of patients are not aware of this. So I always say, hey, we have Headspace. And sometimes I have patients that are not interested in mindfulness. So we find alternatives to meditation and mindfulness. So we do, like, there are other ways to do it. It doesn't have to be like the app that you may don't have. Because I have patients with flip phones, right? So how they're going to do the app. But I tell patients sometimes this is an easy meditation, is that you lay down in bed and you feel like they're little petals of roses touching your toes, and they're going above your legs, and they're going above your thighs. They're touching your belly, and they go above and they touch your head. And you imagine those rose petals touching your face delicately and going down to your body, and you do it up and down several times. You imagine that. That's what I have used for some patients without the app, but those are my 3 top recommendations. But there's many things we do. I think it would be hard to break down all of that.
I think that's very, very helpful. And I think that those things, are easy, low-hanging fruit, don't really cost that much, and are not going to interfere with your treatment, which I think, as Laura had mentioned, like there may be many medical oncologists that poo-poo supplements or such, just because there may be interactions with certain medications that you're on. But I think this is a very hot topic, and I think there's a time and a place for supplements and a time and a place for alternative medicine, but there are times where it can interact with your treatment, and we have to be very cognizant of that. And I'm sure topics such as, turmeric and turkey tail and, other supplements like this come up. So in addition to taking, a very accurate medical history, what do you advise your patients that are asking about taking these supplements or these remedies or these cocktails while they're on active therapy? And are there any that you feel comfortable with continuing?
So let me tell you, to the people here, let me tell you a story, and it's a cash and tell. So I'm very happy with my patients, and I have a lot of younger women in my clinic, as many people know. And I had a patient that was in targeted therapy. She was doing well. We were planning for a pregnancy while she had a complete response. And then I started seeing the cancer started growing. And then we were like, okay, what's happening? And in all the rush of repeat biopsy to find resistant mechanism, I finally called her and said, I'm kind of worried. I think our pregnancy plans, because we do together, or pregnancy plans probably need to be postponed until we figure out. And then she told me she was taking these fertility supplement that she found online. And then I realized that we broke it down, called the pharmacist, that the fertility supplement actually was accelerating the metabolism of the Tagrisso or the osimertinib. So the half-life of the osimertinib was cut very short, and she was using therapeutic benefit because the drug was being metabolized too fast. So then the cancer wasn't growing in the drug wasn't staying not enough time in her body. So that's why keeping the open door policy is so important, because can you imagine we didn't have this conversation? She ended, I wait for osimertinib in a clinical trial, we wouldn't have paused the pregnancy situation and everything. So that's a caution tale, because sometimes these supplementary medicine, this was a fertility supplement, so not even a cancer-directed one, accelerating the metabolism to drugs. It also happens in the other way. I had a patient that was supplemented with these mushrooms that she got online that actually were delaying the metabolism of lorlatinib. And then she was having these awful side effects, and we stopped and say, let's see what's happening. And then she mentioned the mushrooms. And then I didn't know about that class of mushrooms. I wasn't familiar, despite writing so much about it. And I talked to the pharmacist, and then we realized that was happening. Like, she was taking 200 milligrams of lorlatinib instead of 100 because the drug wasn't being metabolized slowly. These mushrooms were competing for the place in which the drug is metabolized. So these are two good cash and tells of having a good open conversation, because my other patient, we are full ahead with the pregnancy plan now. She's not taking the fertility supplement. And my other patient now still continues on the lorlatinib. She's tolerating it well without the mushrooms. So having a good conversation is very important, because there are so many supplements and there's so many options. And I think there's a multi-billion company that's taking advantage of our patients that want to get better, and they want to do everything they can to get better, and they take advantage of that. There has been reports like ginseng, which I'm a very big proponent of ginseng. Ginseng has been associated with improvement in cancer-related fatigue. There has been a randomized double-blind study that was done at Mayo Clinic by Dr. Laprinzi that helps with fatigue. But it's very important where your patients get the ginseng for, because it has been found that certain places, they say they have 1,000 milligrams of ginseng, when in fact, they only have half of that dose, or even a portion of that dose. So even when looking for supplements that could be safe, like ginseng or turmeric, it's very important that you get them for a source they're no FDA control, so they're reputable. And I don't want to mention the brands, but some brands that have been established. And it comes with ginseng and ginseng. There's a Ginseng American Association that they have the product online. They're local farmers that you're getting what you're paying for. And the same for ginger, right? You can also buy the ginger root and from ginkgo biloba just to get it from a source that is, accountable. There's also has been reports of some of these places that social media, we're all in social media. Probably half of the people here found about this talk in social media. So a lot of these supplements you buy online, if they come from the East, some of them have been reported to have fecal matter in it. So it's very important that while you talk to your oncologist, that you also find a place to find these for reputable sources, or so we don't get take advantage of. I use magnesium every night, for example. Like it helps me with my cramps, for example. So just find a reputable place to get it. But of the top supplements I recommend, ginseng has been studied extensively, so I tend to use that. Dr. Jatoy has studied turmeric. Turmeric in a good way to use it and with appropriate medications, and to make sure it doesn't interact not only with the cancer drugs, but with other drugs that patients may be taking. Okay, and one very important thing is blood thinners. With the NOACs, or the new anticoagulations by mouth, a lot of these complementary medicines interacts with. So it's not only about interacting with the cancer drug, but what other drugs the patients may be on. So I tend to use these two. Magnesium tends to be very helpful to relax patients at bedtime. It has been studied in multiple studies in internal medicine to help with these symptoms. And of course, we can use melatonin for sleep as one of the things that I tend to use. But every patient has a very unique need. So, and of course, ginger for nausea. We talk about it, right?
I think those are all very helpful things and very good points to point out, that we're so focused on, interacting with your immunotherapy that you can't take it, but it could cause, it put you at further risk for bleeding or decrease the metabolism, of course, of certain other medications. So I guess my question to you is, when you meet a patient that expresses interest in, supplements and other treatments to take alongside their either targeted therapy or IV chemo or IO, do you try to manage this on your own, or do you typically refer to integrative medicine at Dana-Farber? Like, how do you handle these questions and these patients best?
So if I'm able to answer the questions, I handle it myself. I do work a lot with our loan pharmacist, because she helps me, because I would say 30% of the times I don't know the supplement, because every 3 months there's something new, and sometimes they have a name, and you have to really break down what the bottle has in it. So sometimes I just ask the patients to send me a picture of the bottle or the back of the bottle, because a lot of things sometimes are combinations. And that's something that we have to be careful, because sometimes they can have 10 ingredients that are okay, but there's one ingredient in the bottle that can be dangerous. I work with palliative care too, because in something that we have to talk about it, everybody's in a different state, different rules, is cannabis. So something that I also talk to my pharmacist, and I talk to palliative care or integrated medicine specialists, is about cannabis as well. How the cannabis is taken, how it's used, what is the data out there. There's a great review that was published in the Journal of Oncology Practice early this year, but there's a lot of data about cannabis. And here in Massachusetts, if you are older than 21, you can just walk to a dispensary and purchase cannabis, which is a type of complementary medicine. So I tend to use the resources based on what each patient needs, and each patient's understanding, and not only understanding, but also calendar burden. I'm very mindful of that, because sometimes I suggest acupuncture, but that would mean taking some more time off work and may not work. So we can do things that we manage patients' calendar. A lot of my patients are young women, and they have childcare. They have 2 jobs, right? They have their job or 3 jobs. They're dealing with their cancer, and then they have their children. So I try to adapt a lot, not to add a burden, but also to make sure we address their needs and their issues.
Yeah, I agree. And I think calendar burden is huge. And I appreciate you being mindful of that. We're getting a lot of questions in the chat about diet. And I know you had talked about, food is medicine. So could you comment a little bit about, specific diets, keto, maybe, reorganizing the gut microbiome, and probiotics. Talk a little bit about what kind of diet you advise your patients.
So let's talk about diet and the myths about diet. So there are some things in the chat that I want to not to go against it, but just to explain a little bit behind it. So there's a comment that lung cancer feeds on sugar and that you should eliminate sugar from your diet. The issue with that sugar-free diet is that your liver has the capacity, or it has to, transform fat and protein into sugar. Your brain only feeds on sugar. So when you see your PET scan, you see your PET scan is all light up. So PET scans are sugar-based radiolabel contrast. So that's what you do in a PET scan. It's sugar-based radiolabel sugar. It's radiolabel sugar. That's what the brain lights up. So the brain is only able to take sugar. It cannot break down protein. It cannot break down fat. So even in patients that will go sugar-free diet completely, your body will take that fat and will take that protein, your liver particularly, and will transform it in sugar to feed your brain. It has to be done that way. And in any way that a human functions is to something called the Krebs cycle. And I'm going to describe the Krebs cycle, but the point is that's how we make energy. And it is all based on sugar molecules. So the majority of what we eat, some of it will get transformed to sugar eventually, even with the sugar-free diet. You can go in these carnivore diets that I have seen that are more trendy lately, but that meat or that big steak, part of it we transform to sugar to feed your brain. So just to have that concept clear, that your body has that power and we always have to do it because we have to feed our brain. About the thing that sugar feeds cancer, there are many things that feed cancer. And the cancer will get the energy from the fat and we get the energy from the protein. So because the liver will transform it. So back in my younger years, I did a large animal study in which I give mice a sugar-free diet and I give mice a regular diet. And these mice, when I was at the Fred Hutchinson, these mice had lung cancer tumors. Some of them have breast tumors. These are implanted in the mice. And we noticed that in mice, actually the ones in the sugar-free diet die sooner. A lot of them die close to a starvation. So we didn't find that. There hasn't been a randomized trial of these diets for me to tell you, yes, it's not true. But what I do know, we know physiologically, is that your body is going to transform the protein and the fat. The keto diet comes with the concept that you are removing refined sugars, which is a good concept, right? You're removing refined sugars that we have become, I'm addicted to, right? When I was in Latin America, when I was back home, there wasn't that many bread, there wasn't that many sugar, and everything is smaller portions. So when I moved to the United States, like my dad is here right now getting cancer treatment. He's like, why are the coffees so big in this country? Why the food, like for him, it's like, why is so much bread? Why are they giving us so much bread all the time? So the keto diet has a good concept of removing refined, highly processed sugars. That is, I agree with. I agree with. The keto diet puts people in ketosis, which means that's what you're doing. You're trying to use the fat and the protein to convert to your form of fuel, and that's how people lose weight, right? You're transforming the fat into sugar. But that's what we're just saying that your body will do. I think it has good concept, the keto diet. There has been a small studies, but I think the main concept is that people feel better because you are removing highly processed sugars and carbohydrates from your diet. So people feel better in the keto diet because they're eating more vegetables and they're eating more meat, more lean meats. And that's what a lot of people feel on it. I tried the keto diet myself, but as a pescatarian, it's quite difficult to have a keto diet when you don't eat red meats and barely any chicken. It's very hard. I tried it and I was like, I cannot have more Brussels sprouts anymore. So the best diet is the diet that you can stick to and you can have a good quality of life. And that's what I tell my patients, that you feel good at the end of the day about what you ate. And we shouldn't have to pick one diet over the other because our cultural differences, right? I sent one of my Dominican patients to the nutritionist and she came back angry. She's like, they tell me a diet of squash and kale. Where are the plantains? What are the beans, right? So it has to be a diet that's sustainable, that is highly rich in vegetables and lean meats, but it's sustainable. That's the key to a diet during cancer treatment, and a diet that you can keep. Because the problem is if you do a diet for a month and then you purge the next month, then we lose that benefit of that consistency healthy eating. And to everybody here, raise your hand or use the reactions. We actually generate good serotonin when we eat good food. That has been proven. When you eat a good salad, you actually feel better, right? When you eat pizza, you feel better for 1 second. That's a sugar rush. And then you crash and you feel awful, right? Everybody likes to eat pizza, but 10 minutes later, you're like, why did I do this, right? So the thing is about sustainable diet, and a diet rich in vegetables using your chopping board, and lean meats if they're affordable. And other ways of protein. Not all protein needs to be animal protein. I have vegan patients, I have vegetarian patients. There's many ways to use or find protein that's also affordable. Because honestly, going to the grocery store right now, let's all be very real. You have 4 bags and it's $200, right? So we're not here to tell people to have filet mignon. You can find protein in other ways. Like beans have helped millennium people, like in Latin America, help and grow despite not having access to protein, animal protein. So there's many ways to do that. But the key for the diet is sustainable, that you feel good at the end of the day, good to remove highly processed meats. Highly processed meats has been associated with increased risk of colon cancer. There's a large study about it. And highly processed carbohydrates, particularly refined sugars, because they have an addiction potential. So that's the diet that I told my patients. People say Mediterranean diet, but a lot of people cannot afford to have salmon twice a week, right? So we want to be very mindful. The Mediterranean diet has many benefits, but it also needs to be affordable and sustainable. Because some patients are living from Social Security check to Social Security check, and they cannot, buy an organic feta cheese a block a day, for example. So sustainable, low refined. I'm going to read some of the comments because I think are very interesting. Is that okay with you, Liz?
Yeah, absolutely. I appreciate that.
Randy say it's very hard to stay on keto initially. You have to get used to it. So I think that's what we're talking about, sustainable, what it works for you. A keto diet for a vegetarian is very, very hard. And for a vegan is extremely, extremely hard. I don't say it's not possible, but it's very hard. I have several vegan patients that, they couldn't really, it wasn't sustainable for them. Sometimes as a cancer patient, food becomes an enemy when we worry about what we eat. Keto is a very hard diet. Again, what works for you and is sustainable with the same principles, that you are giving your body healthy nutrients that make you feel good emotionally and physically, because eating is also emotional, right? Let's all be very clear about it, right? When you have a bad day, how many of you really crave lettuce? Okay, let's all be very real. Like, I never had a bad day in clinic. They're like, "Ooh, let me have some lettuce with some balsamic vinegar," right? Like, I want is a brownie. So we need to something that's sustainable, that makes us feel good physically and emotionally, and finding those foods that are right in the middle, that works for you, and be open to new recipes and be open to new foods is also very good to keep that. So Randy says, one school of thought says that follow keto for a few weeks and months and then go back to your normal diet. So go back and forward between keto. The problem with that is that you need to achieve ketosis to be able to get the benefits of keto, but then that takes a while. So if you're going back and forward, you're not going to be in ketosis for long enough. But again, sustainable. What if you find a diet that is between the two, right? That works for you, that is affordable, and that nourishes you, right? The chopping board rule, something that nourishes you. What will you give your kids if they will eat more than chicken nuggets, right? That's how we, I don't know, I don't have kids. About the pesticides in food, preferably it would be good to use organic food, but I understand it's also very expensive. And in some parts of the country, when there are food deserts, you cannot find organic food, right? So you try to find easier and cheaper ways to find organic food are farmers markets. that you may be able to find the food cheaper than in the supermarket because you're kind of cutting the middleman. So a way to find nourishable food, organic, nourishing food, it could be farmers market. And, I always believe in we are an ecosystem. So you help all farmers, you're also helping other people. Is there a standard okay in Germany? Mistletoe?
Mistletoe.
Mistletoe. Okay. Oh, the one that you kiss on it, right? Is that what?
Yes.
I don't have a know about that. I love the chopping block meals. Okay. All right. Sorry. I just want to make sure I didn't miss anything about the food because the food is it's a very long subject. We can have a whole episode about that.
It definitely is. And I think, for our patients that are fortunately well enough to cook or have families that can help cook for them and work on the chopping block, it's wonderful. But then you also have family members or patients that are really struggling, and weight loss is a big problem for them. So I don't know if you advise these patients, high fat, high protein content, you shouldn't be eating low fat yogurt, it should be full fat yogurt, like little simple changes like that. Add peanut butter when you eat fruit, nuts, egg whites, stuff like that. I'm sure you advise your patients too.
And we work with the nutritionist, and we work about with nutritionists and dietitian to find something that works. And now, as a caregiver or a patient with head and neck, that's my dad, I have learned so much more from the other side. So this talk is different to the talk I gave last year about diet, because now I'm the one making the meals for a patient with cancer and a patient that cannot swallow, right? So high protein can be achieved in many ways. And one of them is egg whites. I think egg whites are your best friend, and you can make drinks with egg whites because honestly, asking our patients, Ensure and booze are expensive, and on top of that, you get tired. My dad has had it with the booze. He's like, you give me booze, and I think he has like a vomiting reflex. Like he has so much booze, right? So there are many ways to work with the nutritionist and the dietitian to help. About juicing, carrots and celery are high in vitamin C, and the celery itself is a high fiber source that can really help with the constipation associated with opiates, for example. So I'm a big fan of celery too, and you can put peanut butter in your celery if you like that. I don't like that, but some people do. So celery juicing could be a good way for people to get that are not very vegetable friendly to get high concentration. But don't forget about the fiber of the juice, because sometimes the fiber stays in the juicer.
And I think also, just to piggyback on what you just said, is that juicing should not be replacing a meal. It should be as, an addition to a hearty meal as best you can, or small frequent meals. But, I've seen a lot of patients, and I'm not sure in your clinic, where they think they have to just really cut calories and really now's the time for your crash diets and changing everything. And they turn to just juicing all meals only. And it can be really a shock to the system and in fact, detrimental.
So when that happens, I talk about, let's help. I always come with an open mind. Let's see what you understand, and let's see how we can find a middle point. Because juicing is not sustainable, and we're talking about diets, right? Physiologically speaking, our brain gets more dopamine with the sensation of chewing. So you generate more dopamine by chewing. So there's science behind it. So you juice, great, but you don't get that dopamine either. So it's not sustainable. Like you can do periods of juicing or detox, which some of my women do, but we know it's a short period of time, and then we're going back to the chewing, because it's also good to chew. Right? It's a good process. It's a good, and when you juice, you also remove the social aspects of eating. And one thing that's very important that I talk to my patient, is to eat is the focus, not to eat and watch TV, just to eat and have the social aspects with your family, because eating is not only about the nutrients, it's also about the emotional part. So a lot of times we forget that we connect with our family members at the dining table, right? That's the moment. And when we cut that off, we're also losing that. And right now, for 2 weeks, we were eating away from my father because we didn't want him to hijos eat. And then we talk to him. And my dad is like, it's okay. I know I cannot eat that, but I feel isolated in a corner. You guys are all over there talking. And then I was like, okay, we're going to bring you in and we're going to see how we're going to, make this work. And it worked. Like, he's still only in pure diet, but he's at the dining table with us. Yeah. So I think we can talk about diet. We can probably move about next things because we're already 3:44. So fast.
Exactly. There, some topics I want to talk about are definitely cannabis and CBD, but I'm seeing there's a couple questions that have been brought up a couple times about vitamin C and other supplements. So how do you advise your patients in regards to high dose vitamin C?
So the problem with vitamin C is that has been studied in many different ways by many different people. Okay. Sorry, I know Karen for a while, so I just want to make sure. So the vitamin C has been studied oral and it's studied IV. We do know that you cannot reach the levels that you need oral. That has been done at the Mayo Clinic studies, right? And there has been now, we didn't have a protocolized way to study vitamin C. And that's why we have studies, we mix results, right? Then I would hear, I'd love to hear, you wrote about this. So we have mixed results because it has been studied in very heterogeneous way. Orally, different IV infusions, but there has been some preliminary data about a vitamin C and lymphoma with the Mayo studies. I think the thing is that we have to be very careful in vitamin C for 3 patients. Patients with renal dysfunction should avoid high dose vitamin C because vitamin C is eliminated by the kidney. So the patients that are in dialysis or have chronic kidney disease, patients with hemochromatosis, which is a genomic, is a hereditary disorder in which you don't eliminate iron. You have a lot of iron. Vitamin C can also be dangerous. And patients that may have other contraindications or like alterations of the GI system, if they are planning to take it by mouth. What is your experience? I'm gonna push on your ball court now because I'm the only one talking. How do you recommend your patients about vitamin C?
So I think it can be challenging because the last thing you want to do is cause any complications. But I think finding a healthy balance is really important. So I first try to tap into why are you wanting vitamin C, right? Are you thinking about the health protective effects of vitamin C? Like that's why we take airborne before we get sick and stuff like that. Or are you thinking that you can't really, tolerate orange juice, or you think you're not taking it enough in your diet, so you're wondering how you can get it in? What is the reasoning behind it? And the second question is, where are you getting the IV vitamin C? And can I talk to the team that's giving it to you? And can we come up with a compromise? And I think I really try to start there. I definitely put pause with high doses of anything when you're on active therapy, because the last thing we want to do is result in toxicity. Or have us have to hold, your chemotherapeutic agent because your liver enzymes are through the roof, or, you're having progression because this excess supplement that you're taking is decreasing the efficacy of the chemotherapy that we're giving you. So first, it's all about, like what you had said, NJ, is a meeting of the minds. And I don't think that there have been any large randomized studies that have said absolutely do not use high dose vitamin C, but there haven't been any very large randomized studies saying that the use of it increases your survival or increases your progression-free survival, or, convinces us one way or the other. So I think whenever I have a patient that comes to me with a question like that, the most important thing is to just get down to why are they using that? Is there something else that we can advise that we know has data to get them to that goal, and kind of start from there and work our way up? I don't know if that sounds reasonable, but I have to be very transparent. I'm not as knowledgeable about it as I should be, which is why I often then would refer to our integrative medicine team, alternative medicine, supportive care team that may have more knowledge on this and can speak in a more refined way than me.
I think something that you mentioned very important is what I do for my patients that do IV therapy, because I do have these IV therapy services now are like, you can order Uber Eats, and now you can order a banana bag to be delivered to your house. I guess that may have been helpful in my 20s, but banana bag is just a bag with a bunch of vitamins that's usually given to people that are intoxicated with alcohol. I'm very open with my patients, but I like to talk to the people that are providing the services, because I have found a few sketchy people out there. So my patient is getting vitamin C, I talk about it. I keep my eyes on her or their or his kidney to make sure that we are not having any issues. I talk to the person that is giving the patient vitamin C to confirm the dose and to confirm the product that is being given, because I don't like anybody to take advantage of my patients. And I don't know if I have any patients here that are my patients, but if you mess up with one of my patients, I'm gonna find you and hunt you down. So I really like to have a conversation with the supplier, because there's so many auctions now, particularly in larger cities. And in California, there's actually an app, and this band shows up and can give you coffee ground enemas in your house. And I'm just gonna take a minute to talk about coffee ground enemas. First, they increase the risk of GI bleed. Okay, let's just be very clear. Like, you will bleed if it increases the chances of you bleeding from your colon for a coffee ground enemas. There is no data on coffee ground enemas. I went in this data search for a year to find out where this came from. There is no real evidence that supports that coffee ground enemas really will help your cancer. The concept is that coffee will decrease the inflammation and that will help your cancer. But the issue also is that you're completely removing your microbiome when you're doing these frequent enemas, so you're high risk for C. diff infections. That's when the bad bacteria takes over the good bacteria in your colon, and people can die of C. diff infections. And on top of that, we do know now that your microbiome will affect your response to immunotherapy. So having coffee ground enemas, you're literally just cleaning all your good bacteria out, putting a bunch of coffee on it. Patients may have euphoria when they get coffee ground enemas. So patients with cardiac conditions should also be avoiding it, because they can go in irregular heart rhythms. I had a patient that ended in the ER with chest pain after one coffee ground enema, because it's a high dose of caffeine, right? that you're daily getting it. So I just needed to touch on the coffee ground enemas, because it increases the risk of bleeding. It changes your microbiome, it affects risk for C. diff, and can affect response to immunotherapy. And I don't come for a place of judgment. It's just a place of education in which we talk about it. But yeah, I learned about that. They can come to your house and give you a coffee ground enema. It's an app.
There's a question about probiotics on here, and if we should maybe change the dispenser or change the type that you're taking.
So when it comes to probiotics, the microbiome data that you were talking about, Liz, is very mixed right now. And one of the challenges, one of my friends is doing a study, is it's very hard to collect the samples to do the studies, right? You really need a lot of stool. And when it comes to probiotics, I tend to use the natural probiotics. What is natural probiotics? What you can do on your own. So the full fat yogurt, take your yogurt 15 minutes or 10 minutes off the fridge before you eat it. So some of those life cultures can wake up a little bit more. I know kombucha, right? It smells awful for some patients, but kombucha tends to have very high probiotics. I think if you're in immunotherapy, we have a conversation with your doctor about that. If you are in target therapy and you're struggling with diarrhea, I also will recommend to have a conversation with your doctor before you start the probiotics. But you can have your own probiotics with that diet that we talk about, sustainable diet. About taking it regularly, I think besides the things we mentioned, there is no obvious contraindications, but it hasn't shown that really helps cancer that we know of.
Yeah. And there's also something that came up in the chat about zinc and vitamin C. I think zinc can be very helpful if you have dysgeusia or difficulty with taste or lack of taste. Sometimes I advise just an over-the-counter zinc tablet or lozenge even, but zinc and vitamin C came up. So it seems like vitamin C is a very common thing. I don't have a problem with that.
For the patients that have bad taste for chemo, particularly if they're getting platinum, zinc can be very helpful. But I ask them to get the zinc for a reputable source, not like this random app in Instagram, because you don't know what you're getting. There's no regulation. People can send you a bottle with the label that says zinc, and you're just taking sugar or powder. So just a reputable company to use zinc. The zinc lozenges, honestly, they're awful. I try to try a lot of things. I actually have tried every Ensure flavor and boost This is before even my father had cancer. So when I recommend patients to take something, they don't take awful. Because the strawberry boost is awful. It tastes horrible. In my perception, my opinion. Some people might like it. So the zinc lozenges are rough because they taste, I had tasted them and they're rough, but the zinc does help with the change of taste in patients, if there's no contraindication, of course.
One other question came up about turmeric, and I know you had said that there are reputable sources of turmeric you think can be helpful. Turmeric and osimertinib. Your thoughts on that?
Well, there has not been studies about, and the problem is the dose of turmeric that you take. I think the essential dose is safe, but high levels of turmeric, I actually won't say it is safe because there has not been studies. A lot of the turmeric comes from the breast cancer and the GI literature. So a lot of the things that the Florez lab is doing is try to understand complementary medicine in lung cancer, because what we're doing really, like half of the things that Liz and I just talked about are extrapolated for breast and GI cancers. So we need to understand this also better in the patients that we treat. And that's what is good to do it in the patients that have the disease, because diseases are very different. And trying to use the data that has been obtained for lymphoma or breast cancer to treat patients with lung cancer is sometimes not appropriate, but it's the only data we have. A lot of the work I do in pregnancy and lung cancer is with data in breast, because I'm the one building the database about pregnancy and lung cancer. So just to be mindful that a lot of literature doesn't come from lung. A lot of the things we're mentioning comes from other diseases.
Yes. And I see there's a lot of buzz on the chat that there definitely need to be more studies in this space. And I couldn't agree more, because if we have the data and it's published in a large randomized study, it's a lot harder for someone to say no, right? And it leads to a lot more comfort. But I think it can be challenging to get these studies off the ground. But I see that there's something open at Cornell that was mentioned in the chat, and I think
so I actually know the investigator. He used to be my co-fellow who has the study. So about these studies, we just submitted a big grant to understand complementary medicine and lung cancer. Don't know if the grant get funded, but you throw it to see if it sticks. We keep throwing the ball. I remember when I sold the idea of doing a pregnancy and lung cancer registry, and the grant didn't get funded several times. And now the registry is live as per last Tuesday. So my promise to this group is if I get invited next year, hopefully I have that grant, or at least I have resubmitted it enough times to get it funded. There's one thing, we have 4 minutes, but we want to talk about stress management. And this is something that that I'm actually hoping to get funded to get an intervention. And it's called the PRISM intervention, or PRISM intervention, that is really helps with stress management and resilience building, because we have to give our patients the tool to build resilience during lung cancer survivorship. So stress management, if you had to pick one thing between a sugar-free diet and a stress management, I would pick a stress management 10 times, because that affects our patients systemically. High cortisol levels affect our patients' sleep. You don't sleep, you don't feel better. You eat poorly. You tolerate side effects worse, right? When we have high stress management affects our patients or relationships with our family members. That also affects how our nucleus or support is affected. Stress is also significantly associated with diarrhea. Yeah. When I was giving my first talk at the United Nations, everybody's like, you look so calm. It's like they didn't know I had diarrhea for like 2 hours before that. It increases nausea. When you have a lot of stress and you are in chemo, stress increases nausea, increases diarrhea, affects your sleep, affects your well-being. You're less likely to have a healthy and sustainable diet. You're less likely to exercise. You're less likely to socialize. So what do we have in medicine that will help you with at least 7 things? Barely anything. So stress management through therapy. I have a therapist and I'm very open about mental health with my patients. And Karen helped me. Karen knows when I was going through the divorce how much I needed my therapist. So we had to be very honest that that is also complementary medicine. Mental health and resilience building. It is complementary medicine. And being very open about how stressful it is, like the scans, the copay, the copays for the drugs, the changes to ACME that are coming in January, the social events. One of my patients told me, I like to be alive, but I don't want to be alive to another historical moment. Can we have 3 months without historical moments? She literally told me that. I just don't want no historical moment. I just want to be simple. The news are talking about nothing. So that's the stress, right? That she's stressed about the things that are happening in the Middle East. So stress management is a very important complementary medicine. And there's many ways to do it. Meditation, exercise, and like one of my patients say it, F it. If it doesn't help me, F it. And she's living that policy and she's doing very well now. She cut down all toxic friends from church and she's doing very well.
I mean, I think we have, covered so much today, and your knowledge is just endless. And I thank you, NJ, for your candor, for opening up about your experience, your patient studies, your patient experience. And I'm happy to hear that. I think the main thing is that this door to alternative medicine, complementary medicine, integrative medicine is open. And I think that may not have been the case many years ago. And the more that we learn and the more we talk about it and the more we get it out there, the better. And I do think it's difficult to get these studies off the ground. That doesn't mean that they shouldn't be done. That just means we need to work on it. We need to get this out there. We need big, we need big pharma to get behind us to get this off the ground, unfortunately. And I think the only way to do that is to get, foundations like LCRF, Conquer Cancer, ASCO behind these movements to make it happen. And, the only way is up. So I think we can do better. And I think more to come.
Yeah. And next year, I hope I come here and I say I had the money and that we're doing the study about complementary medicine. Let's see. I'm not giving up because lung cancer is beyond the pill and the chemo I give you. It's about the support, the phone call, and all of that. And that's very 1990s to think that lung cancer treatment is only one thing. And
Yeah.
I don't fit in my 1990s genes, so we shouldn't believe or do that anymore.
So we are over time, and I just want to be mindful of that. NJ, thank you. And if you have other questions or concerns or things that you want addressed, please reach out. And there's going to be an email put in the LCRF chat. You can reach out to the moderators, and they will be able to get those questions to us, and we will do our best to get them fielded for you. So thank you so much. Thank you for your questions. I learned so much today. Have a good rest of the week, everyone.
Bye.